is there. Last presentation by Dr. Sonam, VERMA of this session. Dr. Sonam, please.
Good afternoon, everyone. My topic of presentation is assessment of anterior segment parameters in pseudoexfoliation spectrum. Pseudoexfoliation syndrome is an age-related condition characterized by gradual deposition of an abnormal fibrillar extracellular material in the eye and other organs of the body. It affects about 3 to 6% of population. Males are more affected than females, especially in Indian population. Multifactorial causation has been causing the pseudoexfoliation syndrome with the genetic, UV radiation, autoimmunity, low ambient temperature, slow virus infection, and trauma as a causative agent. Primary effects on the anterior segments of the eye are poor pupillary dilation, pupillary rough defects, breach of blood-retinal barrier, open angle glaucoma, cataract, zonular weakness, subluxation of the lens, and anterior displacement of the lens iris diaphragm. The aim of my study was to compare anterior segment parameters in patients with pseudoexfoliation glaucoma, patients with pseudoexfoliation syndrome, and normal subjects using pentacam imaging, anterior segment optical coherence tomography, and specular microscopy. It was a single center study, cross-sectional in nature, and I had taken 20 patients in each group. On pentacam Scheimpflug imaging, we can see the anterior chamber parameters of anterior chamber depth, anterior chamber angle, anterior chamber volume, all varied between all the three groups, but the differences between the pseudoexfoliation syndrome and pseudoexfoliation glaucoma group were not that significant, but comparing to the control group, the anterior chamber parameters had significant difference. And all these differences were related to the gradual thickening of the lens. That is, the lens thickness has gradually increased from control to pseudoexfoliation group. Anterior segment optical coherence tomography examination. In this, I had compared the angle parameters of angle opening distances and trabecular iris surface area. These parameters were significantly lower in pseudoexfoliation syndrome and pseudoexfoliation glaucoma group as compared to the controls. And on specular microscopy too, on seeing the endothelial cell density, there was a decrease in pseudoexfoliation syndrome, but the coefficient of variation and hexagonality were altered insignificantly between the groups. Our study indicated that there is a progressive decrease in anterior segment biometric characteristics from normal control subjects to pseudoexfoliation syndrome and the pseudoexfoliation glaucoma group. A variety of mechanisms can be causative factors for these findings, such as thick iris, formation of posterior synechiae, zonular weakness. Zonular weakness can cause anterior shift of the lens iris diaphragm, which can be said to cause the variation in these anterior chamber parameters. So there is a progressive decrease in the angle parameters from control subjects to pseudoexfoliation syndrome group to the pseudoexfoliation glaucoma group. Additional studies were needed for better determining the mechanism and significance of these parameters. The limitations were small sample size and the cross-sectional nature. We couldn't follow up the patient, and it was a single center study. Thank you.
Okay, so is it like we already know that pseudo exfoliation can cause shallowing of anterior chamber? So what is so new about this study?
I'm comparing it to, it causes primary open angle glaucoma. I wanted to assess if it is the additional factor for causing glaucoma. So here I'm comparing pseudoexfoliation syndrome group and pseudoexfoliation glaucoma group. So is there again a difference between the two? So difference between the pseudoexfoliation syndrome group and the glaucoma group was not significant, but comparing to the control subjects, it was significant. So it may not necessarily be the causative cause of glaucoma per se.
But next time when you present, you have to show the p-value, because every place you just show us the difference, means this is how much here, how much there, but unless until anything less or more, it will not have some significance unless it will be evaluated by a particular set of statistical tests. So whether these increase or decrease may be significant or may not significant, you have to do some statistical test on it and find out whatever the things are related to this or whatever things not related to this.